Hi friends. Adalimumab is a disease-modifying antirheumatic drug and monoclonal antibody. It works by inactivating tumor necrosis factor alpha and hence by reducing inflammation. It is being used subcutaneously for treatment of various autoimmune diseases. This is a magical drug for patients suffering from autoimmune disease because I have seen patients who were disabled due to their autoimmune disease, and after starting this drug, there was significant improvement in their condition. This video contains full drug information on adalimumab. Before starting, if you learn something or if you find information provided in this video as helpful, please motivate us by subscribing, liking and sharing this video. History of adalimumab. Adalimumab is the first fully human monoclonal antibody approved by the U.S. Food and Drug Administration. Adalimumab was discovered as a result of a collaboration between BASF Bioresearch Corporation and Cambridge Antibody Technology UK, itself a collaboration of the government-funded Medical Research Council and 3 academics, which began in 1993. Initially named D2E7, it was then further manufactured at BASF Bioresearch Corporation, developed by BASF Knoll, BASF Pharma, and ultimately manufactured and marketed by Abbott Laboratories after Abbott's acquisition of BASF Pharma. On January 1, 2013, Abbott split into 2 companies, one retaining the Abbott name and the other named AbbVie. As a result, AbbVie took over development and marketing of Humira. The brand name Humira stands for Human Monoclonal Antibody in Rheumatoid Arthritis. Biosimilars of Humira. In 2014, Indian drug maker Cadila Healthcare declared the launch of the first adalimumab biosimilar at 1/5 of its US price. The generic has been launched under the brand name Exemptia. In 2016, Indian drug maker Torrent Pharmaceuticals launched its biosimilar for adalimumab, called Adfrar. It was the second generic biosimilar of adalimumab. From 2012 until the U.S. patent expiry in 2016, Humira led the list of top-selling pharmaceutical products. Now, since patents have been expired, more and more companies are coming forward with their biosimilars. On October 16, 2018, Amgen has announced that its adalimumab biosimilar Amgevita launched in European markets. Sandoz's adalimumab biosimilar, Hyrimoz, also launched in Europe October 16, 2018. On October 17, 2018, Biogen and Samsung Bioep additionally announced their European launch of Imraldi. Just a few days later, on October 19, 2018, Mylan launched biosimilar Hulio, across major markets in Europe. Drug class. Adalimumab is a member of TNFα antagonists drug class. 5 inhibitors of TNFα are approved for the treatment of a variety of inflammatory illnesses by the U.S. Food and Drug Administration, FDA. Humira or adalimumab was the 3rd TNF inhibitor, after infliximab and etanercept, to be approved in the United States. It was constructed from a fully human monoclonal antibody, while infliximab is a mouse-human chimeric antibody and etanercept is a TNF receptor IgG fusion protein. Other medicines in this class are certolizumab pegol, an antigen-binding fragment of a humanized monoclonal antibody coupled to polyethylene glycol, and golimumab, a human anti-TNFα monoclonal antibody. Mechanism of action. Adalimumab is a recombinant monoclonal antibody that binds to human tumor necrosis factor alpha, TNF-alpha, thereby interfering with its binding to TNF-alpha receptor sites and subsequent cytokine-driven inflammatory processes. By decreasing inflammation, adalimumab decreases signs and symptoms of various autoimmune inflammatory diseases. Indications of adalimumab. Adalimumab is used to treatment of following autoimmune inflammatory diseases. It is mostly used when their conditions are severe, moderately severe, or getting worse, or when there is inadequate response to conventional therapy or when patients cannot use other treatments. In addition to use in adults, it is used in certain pediatric autoimmune disease also. Indications of adalimumab are ankylosing spondylitis, axial spondyloarthritis without radiographic evidence of ankylosing spondylitis, Crohn's disease, pediatric Crohn's disease, ulcerative colitis, hidradenitis suppurativa, juvenile idiopathic arthritis, polyarticular juvenile idiopathic arthritis, enthesitis-related arthritis, plaque psoriasis, psoriatic arthritis, rheumatoid arthritis, non-infectious intermediate, posterior, and panuveitis, pediatric chronic non-infectious anterior uveitis and intestinal Behçet's disease, which is an off-label use. Administration. It is administered subcutaneously. Pre-filled pens and syringes are available for use by patients and the full amount of the syringe should be injected. For subcutaneous injection at separate sites in the thigh or lower abdomen, rotate injection sites. New citrate-free formulations may be associated with less pain on injection. Adverse effects. The most commonly reported adverse reactions are infections, such as nasopharyngitis, upper respiratory tract infection and sinusitis. The adverse effects associated with TNF-alpha inhibitors are potentially serious. However, these risks must be interpreted in the context of the potential benefits and of the adverse effects associated with conventional therapies for the treatment of immune-mediated diseases, which are also significant and in many cases, greater. Thus, the decision to use an anti-TNF-alpha agent must be an individual one, based upon the specific clinical features and unique risk profile of a given patient. Infections are U.S. boxed warning. Patients receiving adalimumab are at increased risk for serious infections which may result in hospitalization and/or fatality, such as active tuberculosis, including reactivation of latent tuberculosis, invasive fungal infections, including aspergillosis, blastomycosis, candidiasis, coccidioidomycosis, histoplasmosis, and pneumocystosis, and bacterial, viral, or other opportunistic infections, including legionellosis and listeriosis. Infections usually developed in patients receiving concomitant immunosuppressive agents and may present as disseminated rather than local disease. Monitor closely for signs and symptoms of infection during and after treatment. Discontinue for serious infection or sepsis. Consider risks versus benefits prior to initiating therapy in patients with chronic or recurrent infection. Consider empiric antifungal therapy in patients who are at risk for invasive fungal infections who develop severe systemic illness. Tuberculosis. Tuberculosis is also an U.S. boxed warning. Active tuberculosis, including reactivation of latent tuberculosis, has been reported in patients receiving adalimumab. Evaluate patients for tuberculosis risk factors and latent tuberculosis infection, with a skin test, prior to and during therapy. Treatment for latent tuberculosis should be initiated before use. Patients with initial negative tuberculin skin tests should receive continued monitoring for tuberculosis during and after treatment. Use with caution in patients who have traveled to or resided in regions where tuberculosis is endemic. Malignancy. Malignancies are also U.S. boxed warning. With the current knowledge, a possible risk for the development of lymphomas, leukemia, and other malignancies in patients treated with a TNF antagonist cannot be excluded. Malignancies, some fatal, have been reported among children, adolescents, and young adults treated with TNF antagonists, including adalimumab in the post-marketing setting. Rare post-marketing cases of hepatosplenic T-cell lymphoma have been identified in patients treated with adalimumab. Melanoma and Merkel cell carcinoma have also been reported in patients treated with TNF antagonists including adalimumab. In an exploratory clinical trial evaluating the use of another TNF antagonist infliximab in patients with moderate to severe chronic obstructive pulmonary disease, more malignancies, mostly in the lung or head and neck, were reported in infliximab-treated patients compared with control patients. Anaphylaxis and hypersensitivity reactions. Adalimumab may cause hypersensitivity, anaphylaxis, anaphylactoid reactions, or angioneurotic edema. Medications for the treatment of hypersensitivity reactions should be available for immediate use. Injection site reactions, such as erythema, itching, hemorrhage, pain, or swelling, and various skin reactions including erythema multiforme, Stevens-Johnson syndrome, angioedema, cutaneous vasculitis, lichenoid skin reaction may occur while on Humira therapy. Autoimmune disorders. Positive antinuclear antibody titers have been detected in patients with negative baselines. Rare cases of autoimmune disorder, including lupus-like syndrome, have been reported. Monitor and discontinue if symptoms develop. Other immune reactions like lupus, hidradenitis suppurativa, idiopathic thrombocytopenic purpura and autoimmune hepatitis can be associated with adalimumab. Worsening or new onset of psoriasis have also been reported. Demyelinating disease. Rare cases of new onset or exacerbation of demyelinating disorders, for example, multiple sclerosis, optic neuritis, peripheral demyelinating disease, including Guillain-Barré syndrome, have been reported. Consider discontinuing use in patients who develop peripheral or central nervous system demyelinating disorders during treatment. Use with caution in patients with pre-existing or recent onset central or peripheral nervous system demyelinating disorders. Heart failure. Worsening and new onset heart failure has been reported with adalimumab and other TNF blockers. Use with caution in patients with heart failure or decreased left ventricular function. In a scientific statement from the American Heart Association, TNF blockers have been determined to be agents that may either cause direct myocardial toxicity or exacerbate underlying myocardial dysfunction. Hematologic disorders. Rare cases of anemia, thrombocytopenia, neutropenia, leukopenia, pancytopenia, and aplastic anemia have been reported with TNF blockers. Patients must be advised to seek medical attention if they develop signs and symptoms suggestive of blood dyscrasias while on adalimumab. Discontinuation of adalimumab therapy should be considered in patients with confirmed significant hematologic abnormalities. Use with caution in patients with a history of significant hematologic abnormalities. Hepatitis B. Rare reactivation of hepatitis B has occurred in chronic carriers of the virus, usually in patients receiving concomitant immunosuppressants. Evaluate for hepatitis B prior to initiation in all patients. Monitor during and for several months following discontinuation of treatment in hepatitis B carriers. Interrupt therapy if reactivation occurs and treat appropriately with antiviral therapy. If resumption of therapy is deemed necessary, exercise caution and monitor patient closely. Immunizations. Patients should be brought up to date with all immunizations before initiating therapy. Live vaccines should not be given concurrently. There are no data available concerning the effects of therapy on vaccination or secondary transmission of live vaccines in patients receiving therapy. Post-surgical complications. Adalimumab increased risk of post-operative infections and delayed wound healing. The long half-life of adalimumab should be taken into consideration if a surgical procedure is planned. A patient who requires surgery while on adalimumab should be closely monitored for infections, and appropriate actions should be taken. Concurrent administration of biologic DMARDs or TNFα antagonists. Concomitant administration of adalimumab with other biologic DMARDs, such as anakinra and abatacept, or other TNFα antagonists is not recommended based upon the possible increased risk for infections, including serious infections and other potential pharmacological interactions. Other common side effects are headache and migraine, musculoskeletal pain, night sweats, mood alterations, including depression, anxiety, insomnia, hair loss, elevated liver enzymes, coagulation and bleeding disorders. And other uncommon side effects also includes pulmonary fibrosis, interstitial lung disease, pneumonitis, pleural effusion, pancreatitis, rhabdomyolysis, sarcoidosis, myocardial infarction, and neuropathy. Safety of use of adalimumab during pregnancy. Adalimumab is considered a Category B drug for pregnancy. Animal reproduction studies have failed to demonstrate a risk to the fetus, and studies in pregnant women have failed to demonstrate a risk to the fetus in any trimester. Well-controlled studies do not indicate an increase in the rate of malformation in the newborn. There were no distinct differences between adalimumab-treated and untreated women for spontaneous abortions, minor birth defects, preterm delivery, birth size, and serious or opportunistic infections, and no stillbirths or malignancies were reported. Due to its inhibition of TNFα, adalimumab administered during pregnancy could affect normal immune responses in the newborn. Adalimumab should only be used during pregnancy if clearly needed. Adalimumab may cross the placenta into the serum of infants born to women treated with adalimumab during pregnancy. Consequently, these infants may be at increased risk for infection. Administration of live vaccines, for example, BCG vaccine, to infants exposed to adalimumab in utero is not recommended for 5 months following the mother's last adalimumab injection during pregnancy. Breastfeeding considerations. Limited information from the published literature indicates that adalimumab is excreted in breast milk at very low concentrations. But, it undergoes intestinal proteolysis and have poor bioavailability. Hence, no effects on the breastfed newborns and infants are anticipated. Consequently, adalimumab can be used during breastfeeding. An increased risk of infection has not been observed in breastfeeding infants whose mothers were using adalimumab monotherapy. According to the manufacturer, the decision to continue or discontinue breastfeeding during therapy should take into account the risk of infant exposure, the benefits of breastfeeding to the infant, and benefits of treatment to the mother. Thank you for watching this video. Please subscribe for more such videos.